Hello and welcome to the 2020 ABZAC Benefits Annual Enrollment Discussion. Due to the recent coronavirus threat, we have prepared a brief video and slideshow to view at your convenience. Today, we will be reviewing what is open enrollment. We will discuss the medical insurance renewal, dental, vision, life insurance, and your next step as an employee of ABZAC. Open enrollment is your annual opportunity to make changes to your benefit elections. This is a time when you should review your needs and make sure you and your family are covered properly. Once you have determined your needs, you can maintain your current coverage status with each benefit, add or remove dependents. You will have 30 days or until April 30th to make any coverage changes. With your enrollment packet, you will have an employee election form. This form will need to be completed and returned to ABZAC. If you elect to make changes, we will need you to complete a separate application authorizing the changes as well. If you wish to maintain the current coverage and benefits, you can state that on your election form. If you don't return your election form, your coverage will default to your current elections. As we begin to review the benefits, the medical insurance is typically a high priority for most employees and their families. We are happy to relay to you that for the 2020-2021 plan year, there will be no changes in medical coverage or benefits. More importantly, you will have no changes in premiums from your payroll. Thanks to your healthy lifestyles, Humana has agreed to continue coverage with no changes. As stated earlier, your medical benefits will remain the same as they were for last year. Enclosed in your participant package is a summary of benefits and coverage. This will provide a summary of how your coverage works. You will have co-payments of $35 for a primary care physician and $60 for specialists. Your prescription coverage has 4 tiers of coverage, levels 1, 2, 3, and 4, and that depends on the formulary list. These prescription co-payments are $10 for level 1, $35 for level 2, $55 for level 3, and 25% of level 4 medications. Your plan also has a major medical deductible of $1,500 for a single and $3,000 for a family for in-network coverage. Major medical is designated as anything not covered under an office visit, for example, testing, diagnostics, elective surgeries, and other approved medical treatments. Your deductibles will run on a calendar year basis. You do have coverage for out-of-network providers. If you utilize out-of-network providers, your deductibles, coinsurance, and out-of-pocket expenses will increase. We would highly recommend using network providers. We will discuss the Humana network and finding providers later in the presentation. Once your deductible is met, you will share in the cost of major medical expenses with Humana. This is called coinsurance. Your plan will cover 80% of medical expenses, and you are responsible for the additional 20% until you reach your maximum out-of-pocket limit. Your maximum out-of-pocket expense will be a combination of your deductibles and your coinsurance. Once your maximum out-of-pocket is met for the calendar year, your major medical expenses will be covered in full for the remainder of that year. If you have emergency or urgent care needs, there will be a copayment associated with each service. An emergency room visit is covered at a $400 copayment. Urgent care is covered at a $100 copayment. Rehabilitation services will be covered at $60 per visit. For all services and questions, please refer to your certificate of coverage for full benefits and coverages through Humana. As noted earlier, it is imperative to manage your providers and make sure your providers are participating in the Humana National Point of Service Network. To check your providers, you can log on to www.humana.com. Once on the website, choose Find a Doctor. In the drop-down box, choose Employer Group Plan. Enter your zip code, and in the next drop-down box, select National Point of Service Open Access Network. Fortunately, Humana has a very broad network of providers and has providers in all 50 states. Included in your Humana medical coverage, there are a number of additional resources that are in your participant packet. First, you have access to download to your smartphone the MyHumana mobile app. This app will give you access to claims, ordering cards, coverage details, the Go365 wellness program, provider searches, and refilling prescriptions through the Humana mail order pharmacy. If available, we highly recommend accessing this app. Other valuable programs you have available are an employee assistance program. In light of today's COVID-19 concerns, you have access to this program to reach support and resources for everyday issues. You have access to a personal nurse. A Humana nurse is available to you for questions you may have about your health. You may at times be contacted by a Humana nurse based on medical conditions. Their goal is to make and keep us as healthy as possible. Use this service if you have any questions regarding your health conditions. Go365. This is a wellness program that allows you to reward yourself for healthy living. Track any activity, exercise, doctor visits, and garner points to spend in the Go365 store. The Doctor on Demand is especially important today. With social distancing in place, carriers and medical professionals are highly recommending using telemedicine prior to going directly to an office, urgent, or emergency care services. You will need to follow the directions in your packet to download the app to your smartphone if available. When you log on to the app and register, you will be able to schedule a visit with a remote doctor or nurse practitioner. They will use Skype or FaceTime technology to reach you at a convenient time. Your dental insurance will have no changes in benefits. There was a small premium increase that will be reflected in your paycheck. The premium changes are on the employee election form. This benefit is a voluntary benefit, and employees will pay the full cost of the premium through payroll deductions. Humana once again will have a network of dental providers. You have improved benefits by utilizing services from a network provider. Preventative services will be covered at 100% with no deductible. Basic services are covered at 80% after a deductible of $50 for singles and $150 for families. Major services are covered at 50% after the deductible stated earlier, and Humana will pay up to $1,000 per year per person for covered benefits. The Humana Vision Plan is also a voluntary benefit and paid by the employee in full. There are no plan changes, and premium adjustments are noted on the employee election form. The benefits on the plan include a $10 eye exam, an allowance of $160 for frames, $10 for standard lenses, contact lenses for conventional of $160 allowance, disposable contacts, an allowance of $160, and any balance over the $160 is a 15% discount. Humana has a network of vision providers, and this benefit is described in the summary in your employee packet. We highly recommend checking your vision center to confirm that it is in network. Your employee benefits package as a full-time employee also includes basic life insurance for you as an employee of $25,000. If married, your spouse is covered for $10,000, and any of your children will also be covered for $2,500 apiece. If you would like to have additional life insurance, it is available through Humana. You will pay the full premiums for additional benefits over the $25,000, and you may be subject to medical underwriting. If you have questions or would like more information on the voluntary life, please call to request rates. Now to the next steps for enrollment. First, we recommend that you review your needs for you and your family. Choose the benefit and coverage elections that fit you and your family best. Complete the employee election form and return to the ABZAC management. And remember, in the event that you don't return the employee election form, your coverage will default to your current elections. We at National Employer Solutions Team, or NEST Benefits, would like to take the opportunity to thank you for serving ABZAC, your employees, and your families. If you have additional questions, interested in additional coverage, have claims questions or concerns, or need service or support on any of your employee benefits, we ask that you call our office at 866-571-6378. We thank you again and look forward to seeing you soon.